Hey everybody, Dr. Z. Welcome to the Z-Dog MD show. Today I have somebody I've been wanting to talk to forever, ever since her work actually changed my mind about the utility of masking. This is Dr. Monica Gandhi. She's an infectious disease doctor and professor of medicine at the University of California, San Francisco, my alma mater. Let's just jump into it. Monica, thanks for trekking down.
Thank you for having me.
I gotta say, your work on this thing has made me more convinced that we can open up, we can return to life if we just do the main thing, which is a face covering. And again, this is a change for me.
Yes.
And now I would love it if you walked us through the available data that supports this theory.
Yes.
Yeah.
Yes.
Yeah.
So you're right, it's a theory, though more and more things keep on coming out that seem like it goes along with it. But essentially, when we started putting this together, it really looks like there are three major fields that come together that provide evidence for this. And it's virologic evidence, epidemiologic or outbreak evidence, and then ecologic evidence. And ecologic means country level data or big settings.
Got it.
So to go through each of those, the virologic, okay, so what I was watching with this infection is this crazy asymptomatic infection rate. Like one setting would have 20% of people becoming asymptomatic, and then one setting would have like a lot higher proportion being asymptomatic. And the CDC finally settled on a number of there's 40% of people with asymptomatic infection with SARS-CoV-2. So then when you look at just this, let's look at this first field, this virologic level of evidence. It really is looking at animal data a lot, that in animals, this is profoundly well known apparently, that the more virus you get in, the more sick you get. And this has been known since the oldest paper we could find was 1938, that this concept of LD50, lethal dose 50, but if you spray virus into cages, that 50% of animals get sick at a certain dose. You need a certain amount to make the poor animals die.
And I saw it was a 1938 study.
1938 study.
And you know what was funny about that study? I looked at it because you'd sent me some of the charts.
Yeah.
They hand draw the graph.
Yeah. I love the hand
It's
drawing.
so awesome. It's you can just see like a guy like, well, listen, see, we're going to draw this out. The more virus you give these little hamsters, see, the more they die. See, it was really amazing.
It was quite excellent that you could do your own drawings.
I
But
know.
you're right.
I know.
And so it was an excellent paper, and it started it out. In fact, it so started it that it became called the Reed and Munch theory, because that was the two authors.
I got it.
And over time, there's probably like 50 animal studies more. There's multiple studies published that the more virus you get in, the more sick you get. So this is apparently in the veterinary world totally known. Then you say, okay, well, how many experiments have been done with spraying virus into humans and seeing how sick they get? Not that many, because it turns out we can't do a lethal dose 50 of humans. You can't do this to humans.
Come
It's like unethical. So the only true study are virus challenge experiments. There have absolute been studies with influenza A, for example. We were trying to develop a vaccine, and you give people a little bit of influenza A, or you give them a lot, and they get more sick. So this was this clinical infectious disease paper in 2015 that you gave people more influenza A. These were volunteers who agreed to do it.
Right.
And they got severe cough and shortness of breath when they got a lot of virus, and they got very mildly coughing when they got a little virus. So this has been, the experimental dosing has been done in humans as well.
That's awesome.
And then the other evidence around viral inoculum in humans has just got to be sort of evidence that with SARS-CoV-2 and other illnesses, the more crowding you get, the more people get sick. Okay, so that's the virologic evidence. Then move on to epidemiologic or outbreak investigation. So at the beginning of this viral infection, like on the Diamond Princess cruise ship, 20% of people were asymptomatic. And then that was one analysis by a Japanese group. And then when they tested more people, so they said 40% of people are asymptomatic. And so the CDC on July 10th said, yep, that's the number. That's the percentage of people who are asymptomatic with SARS-CoV-2
Across
in a
the
typical
board.
outbreak.
Yeah,
Across the board.
world, yeah.
Really well done studies. In a typical outbreak, that's your number. 60% of people are going to have symptoms. 40% are going to be asymptomatic. And then you'd get all these outbreak investigation reports, and there'd be these very interesting settings where 95% of people are asymptomatic. And so we started looking at those more closely. So another cruise ship outbreak, this was an Argentinian cruise ship, They also didn't let people off because they never let people off cruise ships who are like getting SARS-CoV-2 outbreaks. They make them stay there.
Right.
But in this case, they like threw masks overboard and they let them all have masks. And all the passengers masked with surgical masks. All the healthcare workers masked with N95 masks, and their percentage of asymptomatic infection was 81%.
That's a huge variance.
It was a huge variability from that 20 to 40% with the Princess Diamond, and the difference was the compliance and the mandating and the giving of masking.
Right.
And they were the same age group. Like who goes on a cruise are older individuals. So it wasn't any difference in any other demographic variable.
Yeah.
This was the one variable. And these are kind of closed experiments, right? Like a cruise ship is like
it's like a little
setting.
Ecology in itself.
Yes.
Yeah. Wow.
And so then that was the first study that like seemed so different. And then all these other outbreaks, and I think the ones that are most convincing are food processing plants, because quite a few food processing workers got sick at the beginning of this pandemic. And the president actually said, okay, that's essential work. I don't care. You have to do processing. We have to keep the meat processing plants open. But they said, okay, well, we're going to give our workers masks. And so this was a very strict guideline by food processing plants in this country. We're going to give people masks. We're going to keep them apart. And we're going to mandate masking. And then all the other food processing plant outbreaks that have occurred since mandates were put into place with masking have shown 95% asymptomatic rate. So really high asymptomatic rate.
That's super high.
And it's so different
almost
than what was happening at the beginning. It's
right.
almost a not disease anymore. And only 5% of people getting sick. And then there's a paper I'm working on now in another company where they just gave everyone masks and the rate of asymptomatic infection is 95% after their outbreak. So this has been seen in outbreak settings. And then the final piece of evidence is ecologic or country level. Just in general, and I know this is the weakest line of evidence because people can say there's a lot of differences between countries, but just in general, countries that masked from the very beginning, which were all the countries who were used to it from SARS, Hong Kong, Singapore, Thailand, Vietnam, Japan, urban areas in China, they just knew to mask. That was their thing from SARS. They took out their masks, they all started masking. And then the Czech Republic, and I always point out the Czech Republic because they weren't used to masking from SARS, but on March 23rd, they just pulled it out. They said, everyone has to mask. I'm sorry, this is our rule. Make them at home, crochet them cute, like make them cloth. We don't want to like take it away from healthcare workers. So use cloth, but everyone has to mask. March 23rd, earlier than any other European country. And the rate of illness and death has been so low in these countries that when you look at the case fatality rate, it is low. Now that people will say, well, that's because they're only doing testing of people who are symptomatic. And then you can say in return, well, then the case fatality rate should be even higher because it's people who had symptoms, right? That you're testing, and then how many people die who have symptoms? That should be quite high if you're not testing any asymptomatic people to dilute out your denominator to make your case fatality rate, because case fatality is the number of fatalities over cases. But yet their case fatality rate and even their fatality rate from SARS-CoV-2 have been very low. Taiwan has had less than 10 deaths. This is a country of 23 million people, high population density, next to China. On March 6th, they said, you know what? All our factories are going to make masks. We're not going to do anything else. Make masks, make masks, make masks for our populace. And then anywhere you go, you're just handed surgical masks. Like you can't get into a public transportation. You just were handed masks.
Surgical level masks.
Surgical level 2-ply.
Yeah.
And they get into subways and they've had so few deaths. And so that's the other layer of evidence that I think masking is associated with severity of disease.
Now I think it's important because you said this at the beginning, there's a lot of confounders in those, like they had early suppression, testing, contact tracing, all that. But regardless of that, you're painting a picture across the virologic, the epidemiologic, and the ecologic spheres that really support this idea that masks, maybe through reduction of inoculum, are reducing severity and reducing the case fatality rate, which is interesting because that means that then people are saying, well, this is no worse than a flu. Well, it could be true if everybody universally masked.
If everybody universally masked, the case fatality rate is similar to flu in countries where you're universally masking.
And that means you may just prevent one case of someone being on a ventilator, if your theory is right, without causing a lot of harm?
That would be so great, because I don't think it causes harm, and it would be so great if we save illness, and it'd be so great if we get to immunity, and it'd be so great if we now turn our conversation as doctors to both minimizing the impact of COVID and minimizing the impact of the ill effects of the COVID response on illness and human society. That is the time. It's September.